I do not believe in the when you need us, give us a call approach. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 257, and today I want to explain to you guys what we do with our patients on a long-term hearing care basis. But before I do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So as you can tell, I am on a series inside of this vlog where I'm kind of explaining the entire treatment process from the initial consultation all the way to the we're just doing ongoing maintenance with your hearing aids and retesting. And today we're basically on to the part of the treatment where we've gone through all of the fitting of your new hearing aids or your new technology that you're upgrading to from a hearing aid perspective. And now we're on more of a long-term care perspective. So essentially, after we finish a 45-day best practice fitting sequence or a new technology trial, and we know that we're getting significant benefit out of the treatment that we're administering to you, then it makes sense to continue on with your treatment and then have regular touch base appointments with the clinic. Now, a lot of clinics will basically be like, you know what? We're going to fit you with the hearing aids. Once you say, yes, I'm hearing better, it's like, okay, just let us know when you need us and give us a call. We'll get you back in. Other clinics are like, well, now that you're all set up with your new hearing aids, come back every 3 months or come back every 6 months for your routine care and maintenance where we'll do hearing aid cleaning, we'll clean out your ear canals, we may do some retesting, things of that nature. So the approach that we typically take inside of my clinic Applied Hearing Solutions in Phoenix, Arizona is that once we get done with our 45-day best practice fitting sequence or our new hearing aid technology trial, you have a 1-year service plan that you are required to go through with us in the clinic. Now, why do we require a follow-up care plan? Well, we do because over the course of that first year is where a lot of people run into issues with their new hearing aids. And it's not that their hearing aids malfunction necessarily, it's just that, initially we're just trying to make sure that the hearing aids are performing at their optimal level. But sometimes there's new things that you need to learn about your devices as time goes on, and there's not enough time to address all of those things inside of the 45-day best practice fitting sequence, even though we spend a ton of time with individuals in that first 45 days. So what we tend to recommend is that every 4 months over the course of the next year, you're going to come back in. And it's going to be for 3 different types of appointments. The first one is what we call a gold visit. A gold visit is after you're done with your fitting sequence, you come back in 4 months later, you sit down with an audiologist, you spend a half hour with them, you tell them any other issues that may have come up over the course of that 4-month period of time that you didn't realize were going to be an issue or that became an issue after you were completed with the 45-day fitting sequence. That makes sure that we're only 4 months in if there's anything going wrong that we need to fix for you. In that time, we will also do a maintenance check on the hearing aids to basically evaluate how good you have been at doing ongoing care and maintenance of your own devices. We do believe that patients should be doing some self-care when it comes to maintaining their hearing aids themselves. These are medical devices. They are something that they are things that get dirty. There's earwax, there's dead skin cells, there's sweat, there's debris in the air. There's a bunch of stuff that can negatively impact the performance of your hearing aids. So we need to make sure that you're actually doing a good job on that maintenance. And if we identify that you're, not, then we can gently give you reminders of here's how often you need to be doing your hearing aid cleaning. Here's what you do. Here's the supplies that you need to do that with. So just in case any of that stuff got missed or not retained rather inside of that fitting sequence by you, you get re-educated in that. And of course, if everything's fine, nope, everything's been good over the last 4 months, no issues whatsoever, the maintenance is looking pretty good, little bit of debris in the hearing aids, that's totally fine. The next touch point is what we call a drop-off hearing aid cleaning. So for that one, you actually schedule an appointment, but 4 months later, you come back in, you hand the devices over to the assistant, to our assistant. They take the devices in the back room, do all of their maintenance checks on the hearing aids. At the same time, you would report whatever issues you may have been having with the hearing aids, and if it's something that the assistant cannot fix, they will basically loop an audiologist back in on the situation to say, hey, Mr. Jones is having issues with this. I checked out the devices are fine, so it might be something with their hearing, it could be something else completely, but we need to get them back on the schedule with an audiologist so they can handle it. Okay? And so then that's how we solve that issue. Once we are done with that hearing aid drop-off cleaning, we get them scheduled another 4 months out. So now we're looking like literally a year out from when they finish their hearing aid fitting sequence. We're a year out. At that 1 year, it's very important that we go and we do a recap of everything. We retest hearing. We do diagnostics on the hearing aids to make sure that mechanically they're functioning the right way. We do our care and maintenance on the hearing aids to make sure that the hearing aids are in really good condition. And then if there have been any changes in the hearing testing, that means the prescription for their hearing loss has changed, which means that we need to go in and actually reprogram the devices or make adjustments to the devices and re-verify with real ear measurement to make sure that you're still hitting your hearing loss prescription. And we do this at the end of the first year because we don't know how quickly someone's hearing is going to decline. So after that first year, we want to make sure we get another really good evaluation done on them. We want to make sure that before they go off of a service plan, because that's the other thing, we require that they be in a service plan for this time period. We used to be where you could just pay as you go for the things that you need after your fitting sequence. But what we found out was that if we didn't make it mandatory to be in a service plan for the first year, people would just vanish. And then they would come back like 3 years later saying, these hearing aids, after 6 months after I came in to see you, they just stopped working. And so I was just upset and left a bad review. And then I called to come in to have you fix it. And it's like, well, hold on. If you would have come in like we recommended every 4 months for the first year, we could have trained you on the entire process of like, if something goes wrong, here's what you do. So we decided that, you know what, we're going to make people be in a 1-year service plan, make them come in for their visits, and sometimes they're out of state, so we do virtual sessions with them for some of these visits. But that's why we require it, because if we don't require it, people tend to not show up for the care that's really important for them. Like, it's not good enough to just get the hearing aids set up and functioning inside of a fitting sequence. You have to make sure that those hearing aids continue to work long term, and a lot of that has to do with education that we provide to you as a patient. So now, once we get through that first year, we're like, okay, here's everything that we found throughout the course of that first year. Here's how you're doing. You don't have a whole lot of earwax issues. You're doing a great job maintaining your devices. When you had an issue, we identified what that issue is. Now you know the process that you need to go through. If you ever identify anything wrong with your hearing aids or your ears, you can give us a call so we can get you back in. But we don't end there. Even though we are done with the 1-year service plan, most of our patients, I'm talking like 90% of our patients, do not purchase another service plan with their hearing aids. What they do is they pay as they go for the things that they need. And usually we'll extend the treatment process. We'll basically say, okay, you've gone through your first year, you're essentially graduated to the point where you can go every 6 months to come see us in the clinic to do our maintenance checks. Sometimes we'll have them pre-scheduled for a gold visit, which is that 30 minutes with an audiologist. Sometimes we'll have them scheduled for a hearing aid cleaning, which is a 15-minute visit where they drop their hearing aids off with the assistant to get the maintenance done. And then other times it will be a platinum visit. But it just depends on the time frame. We typically don't do a platinum visit, which is hearing testing, diagnostics, reprogramming, all the stuff. We usually don't do that for about every 12 months is how often we do that. But essentially, they come in for their 6-month visit, have a gold visit or a hearing aid cleaning. They get rescheduled for another 6 months after that for their platinum visit. Now, after they've gone through, and that's essentially their second year of care with us in the clinic, if everything is going super smooth, sometimes we'll recommend more advanced patients to be able to go an entire year before they come back in for another hour-long platinum visit. And that's only if they've proven that they can be really consistent with their own care and maintenance, that they are not having any crazy changes in their hearing over the course of a couple of years, and if they are under the understanding that when they do have an issue that they can't solve themselves, that they contact us immediately and come in sooner than once a year, okay? But we found that this is what we have to do to make sure that we maintain optimal performance level. Again, I do not subscribe to the concept of just call us when you need us, because in that particular case, you could be having a person go through an issue for years before they actually call up and say, hey, I'm having a problem. And that problem has been building for literally years at that point. And we just feel like that's a disservice to our patients. So the thing that we recommend, and here's the thing, people can say, Cliff, I know you're recommending I come in every 6 months or every 12 months. I'm not going to do it. I'm like, that's fine. That's totally up to you. But the recommendation is that you come in with this frequency because we've identified that when people do that, they maintain their performance better for a longer period of time. And there you go. That is our process from a long-term care perspective inside of my clinic. Please let me know what your hearing care professional does from a long-term care perspective. Do they have pre-scheduled visits? Do they just say, call us when you need us? Do they do something completely different that I'm unaware of? I would like to know down in the comment section.